equipment. Well, let's talk about all of this now with my next guest. He's the Chief Executive of the NHS Confederation, Niall Dickson, who once again joins us. Good morning to you.
Good morning.
Morning. Thank you so much for joining us. In terms of these death figures, there is, these are very stark. We've crossed the 10,000 mark. There will be realistically higher figures to come, won't there? We haven't reached that plateau yet.
Doesn't appear so. It's always very difficult, as you've alluded to make a judgment about one day's figures, and you are seeing it bobbing around. I think the expert view is that there is at least some sign that, this is not going in an exponential direction, so there's some flattening off of the curve, but it is likely, I think, that the figures will continue. Well, they'll certainly go on climbing. Whether they, whether they accelerate, I think that's the point, that we want to see a stopping of that acceleration, but it's not clear whether we've reached that or whether there'll be another week or 10 days of times when it appears to be accelerating, and therefore the figures will go up even further.
Yeah, indeed. And we know the doubling now is every 6 days. It was previously at one point every 2 days, about a month or so ago. So, that's encouraging. But of course, it's doubling on huge figures. This is the exponential growth we were worried about. Can we talk about the NHS workers, though? You represent the NHS Confederation, representing the NHS Trust. 39 NHS staff, I believe, now to have died of coronavirus, ranging from hospital consultants to nurses to porters in hospitals. Really big issue about the lack of personal protective equipment, the PPE. Government keeps saying there's enough of it. There were hints even from Matt Hancock, the Health Secretary, over the weekend that perhaps it was being wasted, some of it. People were using protective equipment when they didn't need it, or the more exacting protective equipment which they didn't need at that time. And yet we're told constantly, again and again, by NHS staff, they haven't got this equipment. What's going wrong? Why is it beyond the wit of man to get latex gloves, paper masks and plastic aprons to NHS staff?
Well, I think there are two different things here. First of all, there's stuff going out into the community, into care homes, and I think the distribution of that has been more difficult, and I think originally the supply chain set up by the NHS simply didn't work or the government didn't work in order to get that material out there, and I think there are still issues in terms of the community and care homes. As far as hospitals are concerned, in general, and I say this very carefully, I think that the right PPE has been delivered now and is being delivered now, but there are particular issues. There is a particular problem with gowns. Gowns are used when people are dealing with individuals who have need a high intervention. In other words, it's usually in intensive care or those kind of environments where somebody needs the highest level of kit. And
so they're not just wearing those plastic aprons; they're wearing the full-on gown with sleeves and the works.
Correct, and the face mask and the different face mask. And the guard over their face and all the rest of it, and it takes a lot of time to put that stuff on and off. And that may be what Matt Hancock was referring to, that some people who were not dealing with those kind of patients were sort of using that kind of equipment. And the problem is that they have a shortage of gowns, and there are additional supplies. I believe 200,000 were delivered from Ireland. There are more gowns coming on the way, but there have been difficulties of delivering that, and also of developing people here to produce some of that stuff. And again, there are British manufacturers who are starting to do that, but there have been issues where I think the expression was used dangerously low rather than running out in terms of hospitals using the gowns in particular. On the wider issue, I think that the main problem is probably in the community and in care homes and so forth, and making sure that they A, have the right equipment, and B, have the right guidance. Now, the government produced its new NHS PPE plan on Friday, and says, look, there is now very clear guidance, and there will be the appropriate kit. And
that's the guidance about if you are doing this or that job within a care home with this or that patient, whether they're at risk or isolation, this is the equipment you need to use.
Yes, that advice, which initially I think wasn't clear enough, and even the distance you had to be from patients and what sort of distance you had to be within those kind of environments and how it worked was not clear. And I think there is now more specific guidance for particular situations that staff face, and that guidance has been approved or supported by the World Health Organization and the medical Royal Colleges and the Royal College of Nursing and so forth. So I think there is clearer guidance now, but that wasn't clear before. And secondly, I'm told that in the community there is now an awful lot of stuff, as you said, being pushed out there, and that there should be an end to the problems that they have. But I believe that there are still problems in parts of the country, remembering, of course, this is a vast system, so even when you generally get it right, there may still be problems on the way, but they're all
exactly. And I assume also that the staff who've got the kit aren't on social media or contacting journalists or indeed other bodies to say they've got the kit, and therefore we do tend to hear those stories. But Chris Hobson of NHS providers, representing also hospitals, ambulance, mental health trust, has said that the delivery in some areas for PPE is hand to mouth, and it's this is just in time stuff. There is a problem. Some of the papers today reporting that the government's flying in PPE kit from China. China is the country that makes most of the stuff. Of course, there's been lots of delays with lots of factories shut down in China, but some of this kit, it's wrongly labelled. They've ordered masks, they get gowns, or the other way around. It's out of date. It's failing the safety tests in this country. This is stuff that has been ordered weeks ago. This is a government that did actually get on with it and order it, but it's arriving and it's no use. How big an issue is that for you at the NHS Confederation?
Well, I've heard about the difficulty of individual packaging not being right. I haven't heard that it is a major issue. The major issue has been getting the supplies and getting those supplies coming through, and the particular issue has been around gowns. The original supplies, which were built up as a huge stockpile, were for influenza. That was the anticipated, and again, people will look at this and say, well, it should have had a different approach. But the stockpile that we had put together as a nation, and some nations didn't have a stockpile at all, but was for influenza, and that meant that this virus is quite influenza-like, but not exactly. And the demand in particular, for that high-level PPE kit is much higher than would have been in a normal influenza pandemic. And that's partly why I think the supplies weren't all there originally. Yeah. Even though we had additional supplies because of the no-deal Brexit, we built up more PPE in that sense. But it was all in a central place. It wasn't distributed around the country, and I'm sure there are lessons that can be learnt going forward. But I think I prefer to concentrate now on what's the situation now. Is it going to get better? Can we believe the assurances that are being made? And certainly the assurances are being made that there's been a significant improvement. They are getting stuff out to the community, and that they are solving the particular problems in parts of the country in the acute hospital sector where there's been a particular shortage of gowns in particular. But we will need to see over the next few days and get reports from our members as to whether this is actually happening on the ground or not.
Yeah, absolutely. Well, thank you very much. Really interesting to have your thoughts on this. Niall Dickson, Chief Executive of the NHS Confederation, thank you.